Okay, so let's get us started. Okay, welcome everybody. It's so nice to see so many of you in the room today, so many of you online. So welcome to this year's annual event of the Climate Action Accelerator, Against Time and the Odds, Accelerating Climate Action Today to Better Serve Populations Tomorrow. So we are very excited actually by today and by the conversation and the discussions we're going to have. Let me just start with a couple of housekeeping rules, if that works. So let me just say them out loud. Thank you so much. So we are very happy to be able to host actually an event which is both in English and in French, and in person and online. So as always, adds a little bit of complexity. So for those being online, you have access to the translation, you have access to the chat. So please, for the translation, select the channel of your choice. And as we're going to do the Q&A after each of the panels, in each of the sessions of the day, for those being online, please write your message in the chat. And we have a colleague here, Paolo, who will read the questions for you. Yeah, so that's easier for everybody. Okay, so now that we're set with the housekeeping rules, just a couple of words on what we're going to discuss today. What is our red thread for the day? So what we want to focus on today is actually looking at the impacts of the climate crisis, the climate shocks, the shortages and the limitations on natural resources, and the consequences it has on inflation, on instability, political, financial, etc. These increased constraints that we're facing today and we're going to face increasingly tomorrow, how does it affect our capacity to deliver as organizations and systems? What are the consequences for us? And actually, we're going to spend the day, including as we're going to start with our keynote speakers panel, we're going to try and look at what are the possible scenarios for the future, and from there see what are the set of measures that are being that are in need of being developed today. And of course, at Climate Action Accelerator, what we are very keen to explore more specifically is how can climate action actually contribute to reinforce our resilience, our organizational resilience, our systems resilience faced with these constraints. We have, so this is going to be our red thread for today, and we have a fantastic program lined up to explore this connection, these themes. First, with our keynote panel, keynote speakers panel, sorry, is going to help us to really introduce the day and set the stage on the theme. We will take also a little bit of time to ask Climate Action Accelerator to introduce some of the learnings and the knowledge that we have generated through our work with our partners. What are these tools? What are these approaches in climate action that can actually help, again, if they are deployed at scale and at pace, to reinforce this resilience and to be stronger to deliver services to populations. And after this first sort of part of the day, we will zoom into thematic roundtables. One of them, the first one, we'll be looking at, we will very much explore what are the needs of local actors in climate action acceleration, and how can we, as international actors, global actors, and local actors, better partner together to meet those needs and to increase and to accelerate climate action. Of course, bearing in mind that local actors have been at the forefront of looking at resilience, adaptation, and mitigation in a comprehensive, holistic approach since many decades now. I didn't mention, so don't worry for those in Geneva, we have a wonderful coffee break at 11. And we have as well a networking lunch at 1 p.m. Then the program continues, hopefully, yeah. In the afternoon, we have a second thematic roundtable looking that time at the specific role of donors and grant-making organizations in climate action acceleration. So what can they do more and better to enable, incentivize their partner organizations to do more in climate action? And finally, we're very lucky. We have a very nice also final panel discussion to really try and summarize and gather all the elements we would have discussed during the day into a final discussion looking at the impact of the climate crisis and increased resource shortages on the way we deliver services to populations. And we're going to delve more specifically at what is this impact for organizations. What does it mean for a health organization, for a humanitarian organization, for a private sector organization, for an insurance company, etc. And finally, we're going to anchor the end of our program with closing remarks, which are going to be delivered by our friends from the Canton Genève and from activists in Geneva. Okay, we will be delighted to finish the day, and apologies for those being online and that you're not with us, but we'll have a nice cocktail at 5 p.m. in the Maison de Maître, just here in La Pastorale. So most welcome to all of you to join. With this, I hand over to my dear friend Elise Buckle, who is our moderator for this first panel discussion. Elise is the president and CEO of Climate Bridges, founder of She Builds Bridges, and co-chair of International Gender Champion Climate Impact Group. So Elise, thank you so much for being with us today, and I hand over to you.
Thank you so much, Beatrice, Bruno, and everybody here. We're very, very happy to see you here today. I think this is the third edition, is that correct, of these Climate Accelerations Days. I'm very, very happy to be here and really honored to be here. Actually, Bruno and I met at the UN about 4 years ago when the Climate Action Accelerator was just an idea. And I was very happy to actually serve on the board for about 3 years in a very rapid growth for the organization. I think we're also here to celebrate what has been achieved over the last few years and these amazing people who have been working as a team, also with Pierre Burrier and many others, working against the odds to really try to address the climate crisis, to walk the talk in this sector, and at the same time, serve people and their needs, because we know that we are also in a humanitarian crisis today. So it's really a pleasure to be with you today. I'm going to introduce our panelists. We're very happy to have with us today Owen Gaffney, who is the Chief Impact Officer at the Nobel Prize. He's also the co-lead of Earth for All. He's actually one of the main authors. I know he's very humble, so you may not know that. And actually, Owen and myself also work together a lot on the Planetary Emergency Partnership. I think that some of you here were part of that for some time. We also have Mathieu Ozano, who is joining us online. Mathieu, can you say hello, just to make sure the sound is working? Can you see Mathieu?
Yes, I can say hello.
Great.
Hello.
So Mathieu is the director of the SHIFT project. I'm sure you've heard about the SHIFT project, a groundbreaking initiative in France and beyond on how we can really decarbonize the economy. We have also with us Dr. Jemila Mahmood, who is executive director of the Sunway Center for Planetary Health. Jemila is also a board member of the Climate Action Accelerator. So thank you so much for being with us today. I know you've been traveling extensively, New York Climate Week, and then going back to Malaysia. So it's really a great honor to have you with us. And last but not least, Simon Zadek, who is the co-CEO of Nature Finance. And obviously, we all know that climate, people, and nature, everything is interconnected. So very happy to have you with us today. So in terms of the first round of introduction, I wanted to ask all of you to share a few words about resilience. What does resilience really mean to you? What kind of inspiration it brings to you? This is the topic of the day for this conference. And if there's anything you want to share, what was maybe some kind of wake-up call or a moment that really made you think, okay, we really need to address this climate crisis, actually working as one team on both mitigation, adaptation, and resilience, but also going beyond our divides, going beyond the north-south divides, and building a bridge also between climate action and humanitarian action. So working as one team on one planet. Well, Jemila, I think you have something to share, so over to you.
Thank you very much, Elise. Good morning, everyone. Thank you very much for having me here. One thing that Elise didn't tell you is that I'm actually an obstetrician and gynecologist. So that was my training, and I'm a recovering humanitarian, I would say. The aha moment for me came in 2019, just a couple of months before the pandemic kind of shook our world. As a younger humanitarian, I remember in the year 2000, the profound images of a woman in Mozambique climbing up a tree with the raging floodwaters below, and there were crocodiles in the water. And she delivered her baby on the tree, clinging on to that child until a South African rescue helicopter came to haul them up to safety. As an obstetrician, I was horrified. I delivered many, many babies, about 15,000 to be precise, in my career. And I cannot imagine how someone could deliver on a tree because they are very slippery when they come out, right? And that image haunted me for many years. And those who know me, and Nishani has worked with me, so she can tell you horror stories. If something hits me and really touches me, I follow it up till forever. And I followed this story. The name of the baby is Rosita Mbongo, and the mother suffered horrific gender-based violence at home. She finally divorced her husband. This is how deep I go into history. And Rosita wanted to be an engineer. In 2019, I was working with the International Federation of Red Cross and Red Crescent Societies, bringing donors to Mozambique after a flood. We were playing with kids and talking to the midwives and the nurses. So I just gently said to the midwife, the image of Mozambique I have in my mind, unfortunately, is of this woman giving birth on a tree. And she just smiled at me and she pointed to a little boy that I was playing with. And she said, his mother just gave birth on a tree. So that was a moment that I had so many mixed emotions. I was angry, I was sad. You know, how is it that in 19 years, women still did not have, you know, the access to healthcare? The climate crisis is getting worse. And I felt guilty that perhaps we as humanitarians were just putting Band-Aid on huge gaping wounds without looking at underlying drivers of crises. So resilience to me at that point was, there was no resilience, right? And it's so easy to use the word resilience, but really, do we really build resilience unless we have political will and we shift systems? So at that time, that was 2019, the planetary health movement had been around for about 4 years then, arising from a Lancet commission in 2015. And that's how I started to say, okay, my next move must be to study what planetary health is all about. Owen, I have your book with me because this was one of the inspirations for me as well. And until and unless we start looking at systemic shifts, that it is ultimately about social equity and justice. It is about political, social, environmental, economic drivers that we need to look at. We will always be putting Band-Aid on gaping wounds. Thank you.
Starting with some applause already. Thank you so much, Jamila, for this story that's really touching our hearts. And actually, as you see, we are also both dandelions. The Dandelion campaign is a woman-led campaign for climate justice, started by Mary Robinson and many others. And it's also a symbol of resilience. It's the flower that grows on 7 continents. So it's also about spreading hope. And there is a lot of anger and sadness when we see these situations and this suffering. But how can we also build bridges of hope to actually address these challenges? And I'm so happy you followed up on that. And I'm sure that many women around the world benefited from your work and became more resilient also in to face this crisis. Thank you so much for what you've done. So indeed, the planetary crisis and the planetary health is deeply connected to human health. And actually, with the Planetary Emergency Partnership, we were one of the first few groups to connect the dots between planetary health and human health. So, Owen, how does it resonate with you, this topic of resilience?
So thank you so much for the invitation to be here. It's an absolute pleasure. So the topic of resilience, I mean, and I'm formerly at the Stockholm Resilience Centre, where we've spent decades trying to really understand resilience, trying to define resilience, and particularly the resilience of social systems, economic systems, and the biosphere, and these linkages between these systems. And so as a very basic definition of resilience, we talk about being able to adapt and grow stronger to changing conditions. And if I have an aha moment, I've got several aha moments, I suppose, maybe I can summarize. But in the first book I wrote, Breaking Boundaries, a few years ago, I was doing some research on the deep changes in the deep past on Earth. And I had a big realization on resilience of life. Life is such a resilient thing here on Earth. It's the only place we know there is life, but it's very, very resilient here. And why is it? What gives it that resilience? And there's many reasons for that. But one of the reasons is the complexity and the biodiversity. So more life, more different types of life creates a more resilient system. And we can see that with, Earth used to go into these very, very deep ice ages called snowball Earths, where the entire Earth would be, right down to the equator, would be covered in deep, deep ice. And this would last for millions and millions of years. And very little life could thrive in those sorts of circumstances. It was a very, very violent, crazy world of deep ice ages, then out of these deep ice ages, these snowball Earths or slush ball Earths. But then when complex life arose 500 million years ago or so, once we started getting complex life, we stopped getting these very, very deep shifts on the planet. The climate stabilized around some medium, and that gave rise to more life. That increased complexity, and in fact, the biodiversity on Earth has been increasing and increasing and increasing, increasing in complexity until humans started affecting it in a major way. And now we're simplifying the biosphere in quite a profound way. We've used half of the land surface. We're just growing monocultures, monocrops, etc. We're stripping away the diversity that gives the planet resilience. And I'll talk a bit more about that in the morning. But then, and if I could just say another point on resilience is that it's quite a neutral concept as well. We often use it in a positive way, but authoritarian regimes are very resilient. Populist regimes are very resilient. Totalitarian regimes are very resilient. And so, in fact, what we need to understand is when and where we want resilience. How resilient are democracies? How do we strengthen democracies, given that we need to go through these huge transformations over the next decade? If we value democracy, we need to make democracy resilient.
Thank you so much, Owen. Indeed, a question mark on the future of democracy. I'm sure that will come back in the debate. And also, I guess this passion you have for protecting life on Earth and protecting life for newborn babies, for the future generations, but also for biodiversity at large. And we know, Simon, that you are also an economist, and you've been also trying to build a bridge between the economics and nature. How do we have a life-centered economy? How do we channel financial resources to nurture and to protect biodiversity? So any thoughts in terms of resilience for you? What does it mean?
Thanks, Elise. And not the subject of my first couple of minutes, but I'll definitely come back to it in discussion. So resilience. So I wasn't really quite sure what I was going to talk about in these opening comments, but like perhaps others in the room, since 2 o'clock this morning, I've been focusing on the news. And I can't really think of anything much really that's closer to resilience than people that are today living in Gaza and Israel and obviously Lebanon now as well. And we could add Sudan and Myanmar, and the list is long. And so, resilience, despair, anger, purpose, all of these things seem to be part of the same thing. You don't go, resilience is inspiration. Yeah, I don't really think that's a realistic description of what it's about. And then here we are sitting in Switzerland, kind of like voyeurs, perhaps active in some ways, but surely just wondering why we can't really do anything. And then I want to connect it back to climate, but not through some smart scientific quip about the link between the war in the Middle East and climate change, but just the extraordinariness of our inability or unwillingness to address climate challenges at scale, whilst we seem very willing to destroy each other at scale. That we're willing to throw hundreds of billions of dollars in a short period of time into war machines from every side, and yet are completely unwilling to throw the equivalent money or energy or purpose towards what brings us here today. And so what does resilience mean for me in that context? It means still getting up in the morning. It means believing that purpose, drive, our view of climate change, our role in addressing climate change and all of the interrelated pieces that go along with it is still worth doing. Yeah, and that seems to me, as we move forward into the future, going to be a greater and greater challenge as more and more complexity and pieces of the puzzle that are not working encourage us to give up, step back, go to the beach, focus on our families, make sure we have water, money, and power. And so resilience is something to do with continuing to believe that solidarity counts and that we can turn solidarity into practice at the individual level, but ultimately at scale. We understand how to help individuals, but we all probably work in institutions that seek to help people at scale. And my guess is if we spend some time talking about the institutions that you're part of, we would talk a lot about the shortfalls in what they're doing. So resilience is believing that we can maintain and scale our solidarity, that we can try and channel humans' extraordinary ability to destroy each other into something that is more productive for us all. Thank you.
Thank you so much, Simon, for that. And I think all of us have been really touched by what's happening in the Middle East. And we have many friends in Lebanon, in the region. Now things are escalating between Iran and Israel. I have many friends who are climate leaders in Lebanon. I'm sure you have a lot of friends who are humanitarian actors on the ground right now, trying to help people, to bring hope against all odds. So I think this is actually the right moment to have 2 minutes of silence, of mindfulness, to be with them, with our heart, with both the climate leaders and the humanitarian actors who are there, and to also just reflect on what you've heard, the stories that you've heard from our panelists. So just 2 minutes. You're welcome to close your eyes, and of course, Mathieu, you are welcome to join. Everybody online as well, we're just going to take 1 or 2 minutes of mindfulness and silence, just to also reconnect with what you said, Simon, our shared humanity and why we are here today. Thank you. So before we open our eyes, we're going to breathe very deeply 3 times. You can keep your eyes closed if you'd like, and just breathe really deeply 3 times, inspire and expire, and just try to reconnect with the earth below you and also with all the people around you. And just sending our love and compassion to the people who are in the Middle East right now, who are really struggling. So now you can open your eyes and reconnect with each other. I hope you also feel more grounded, more relaxed. I'm sure there's a mix of feeling in terms of despair and hope at the same time, and it's okay to have the 2 feelings at the same time. Mathieu, before we turn to you in Paris, I'm just going to ask Owen first to share a few words about the planetary boundaries. So Owen, you are really a visionary leader, I would call you like that, because you see that we need to operate within a safe space for the future. Could you share your reflections on that? And in particular, how do we communicate about this climate emergency when we know we have to cut 50% of our emissions every decade to get to net zero by 2050? But when we also know that there are also people who are struggling with day-to-day priorities, like what's happening in the Middle East. So how do you combine this urgency of action and also these timelines in a way you have the 2050 benchmark? And how do you translate that in terms of your communications to make it more tangible for also the life in the day-to-day world?
Thanks, Elise. And yeah, that's quite a big brief to cover off. So I'll try to do it in a few minutes. But I guess that another key realization over the last few years is on climate tipping points and the risks we're taking with climate tipping points. That we see, 15 years ago, with first papers on tipping points came out, synthesizing the different types of tipping points we might see when it comes to the Greenland ice sheet, when it comes to the Antarctic ice sheet. Both of them contain many, many meters of, they'd raise sea levels many, many meters if they collapse, or the Atlantic overturning circulation, or the Amazon rainforest, or coral reefs, or Arctic sea ice, and multiple, about 15 key tipping points in the Earth system that are at risk. But our knowledge then was that, well, maybe at the end of this century or the next century, then we might get into a danger zone with these. But in those last 15 years, we've been measuring real-time data coming in from these systems, from the Amazon, from the Atlantic. I sailed across the Atlantic Ocean, putting in the first research systems to measure the thermohaline circulation in the Atlantic. And we're seeing, every single system we're looking at, we're seeing massive, massive, profound changes going on there, raising the question, are we already at that danger point? And now we can say that we are coming very, very close, even within the Paris Agreement, where we've agreed to keep temperatures well below 2 degrees. Even between 1.5 and 2 degrees, we're at high risk of crossing tipping points. And this will be extremely destabilizing. We've had a stable system, climate system, for 10,000 years, since the dawn of agriculture. Agriculture was possible because of that stable system. And now that system is in deep jeopardy. And the most marginalized places in the world will feel the biggest impact. And that is the Middle East. That is the countries around the equator. They will see the biggest impacts. We will see adaptation. We're already seeing adaptation, but what kind of adaptation are we seeing? You know, if you're very wealthy in the Middle East, you can move to Europe in the summer. If you're, that's an adaptation, right? But for most people, that is not possible there, and you just have to suffer, you know, 52 degree heat. You know, 1,300 people died in the Hajj pilgrimage this year in Saudi Arabia. This is, you know, this is shocking, and this is at the very early stages. You know, if we're reaching 1.5 degrees, we're nudging on that boundary right now. At the same time, as I mentioned in my opening remarks, we're reducing the resilience of the Earth system. And this is where the planetary boundaries comes in. It says, what are the systems that keep our planet stable? And at Stockholm Resilience Center and Potsdam, we've identified, you know, 9 boundaries that keep Earth in a stable state. And now we can say we've crossed 6 of those boundaries, obviously including climate, obviously including biodiversity, and of course, land use and others. So we're in a really high-risk danger zone situation right now, which we need to pull back. The good news is, if there's any, is that one of those boundaries is ozone, and it is in the green. We're in a safe zone for that. We were not always in a safe zone for the ozone layer. We were in the red zone in the 70s and 80s. We saw that there was a huge danger, a huge problem, and we came together collectively and addressed it. And now we have we're within that safe zone, and we should expect a full recovery of the ozone by the end of this century. So it is possible to act collectively on these issues. The key priority is climate, is reducing emissions as fast as possible. Back in when the Paris Agreement was signed, we were looking at what does this actually mean? It's very easy to ignore the Paris Agreement when you have a target of net zero sometime in the second half of this century. We looked at the models and came to the conclusion we needed a communication that put the urgency. What does that mean? What does net zero by around 2050 actually mean? It means halving emissions by 2030. So myself and colleagues published a paper in 2017 articulating that trajectory, which was then supported a year later by IPCC's 1.5 report. And that as a communication has gained traction without doubt. It is great to see these NGOs here supporting that, and many thousands of companies and countries supporting that trajectory. But it's also galling to us to see, well, there is huge support. We're not making any actual progress on the global scale. Emissions are not falling. Here we are going into 2025. We should be making massive reductions but emissions look as if they may be plateauing. The good news is, though, even here in 2020, moving into 2025, even with 5 years left to 2030, it remains technically and economically possible for the global economy to reduce emissions 50% precipitously. So if it's technically possible, if it's economically possible, then we can just say that the political will is not there yet to do it. It's certainly public will is there to do it if the policies are right, if the policies are fair. So I'll finish there. You know, we still need, that is the absolute trajectory we need to be on. We should not give up on pushing for that as hard as possible.
Mm. Thank you so much, Owen, for this very down-to-earth reality check on what's happening in terms of what the scientists have been predicting for years, and that's starting to happen. And indeed, what's happening in the Middle East is also linked to the planetary crisis, because there is also a lot of tension in terms of access to food and water, and indeed agriculture. Sometimes you wonder if it's really possible to adapt. So that's all about the systemic shocks and how are we prepared for that? Open question for you after that in the debate. Now turning to Mathieu. I know, Mathieu, you've been waiting for joining from Paris. Thank you so much for joining. The SHIFT project has also been clearly a pioneer in terms of a new vision for the economy. So anything you'd like to share? I think it would be good to hear from you in particular about the health sector, because the Climate Action Accelerator, as you all know, has been launching these sectoral roadmap for the humanitarian sector, which is really creating a domino effect now, really driving the whole sector, creating positive change in the whole sector. And the accelerator is just starting to engage now with the health sector. So that's always the question, you know, how do we actually transition away from fossil fuels, for example, for hospitals, when in some regions of the world, you still need fossil fuels to have energy when there is an electricity breakdown at night, for example, for delivering babies at night. So how do you make sure the whole economy is resilient, taking care of people, of their needs? How do you make sure the health sector is resilient, and at the same time decarbonizing the sector? That's quite a big challenge. Thank you.
Ouais. Bonjour à tous, merci. Désolé, je vais répondre en français.
If you can speak louder, that would be wonderful. Thank
C'est mieux
you.
comme ça? Est-ce que c'est mieux comme ça? Ouais. Ok. Le Shift Project, c'est un groupe de réflexion.
Even louder, or if your
Even
mic can be
louder.
closer. Yes.
Okay.
Thank you.
Maybe like that is gonna work better. C'est mieux comme ça ou pas?
Much better.
C'est mieux comme ça ou pas? Le son? Ouais.
Yes.
Ok. Ouais, je viendrai, je terminerai peut-être parce que le travail qu'on a fait en France sur le bilan carbone de la santé, mais je voudrais peut-être profiter des introductions très inspirantes qui ont été faites pour moi-même répondre à la question première qui était qu'est-ce que ça évoque pour moi la résilience, et terminer sur la santé. Pour moi, pour nous, au Shift Project, qui est un groupe de réflexion sur la transition bas carbone, sans doute le premier facteur de résilience, c'est réaliser collectivement que nous sommes en danger. Malheureusement, c'est un thème qui a été évoqué, et du coup, j'ai envie d'un peu d'élaborer sur ma propre expérience. Ma propre expérience, c'est que réaliser collectivement que nous sommes en danger, malheureusement, ça peut prendre beaucoup de temps. Moi, avant de diriger le Shift Project, j'ai longtemps été journaliste. À la fin des années 90, au début des années 2000, j'ai fait des reportages en Alaska, en Inde. J'ai travaillé aussi beaucoup sur l'Irak et sur la guerre en Irak. Et il me paraissait évident que la transition, sortir des énergies fossiles, c'était l'affaire du siècle. En réalité, j'ai vu dans mon pays que ça a pris pratiquement une génération avant d'arriver à un niveau de partage de cette notion de danger collective suffisamment puissante pour passer du diagnostic à la thérapie. Bon, je dirais, moi, mon expérience, c'est que ça a pris une génération. C'est extrêmement frustrant, mais en même temps, à l'échelle de grands systèmes sociaux, une génération, c'est pas si long que ça, c'est très long, mais c'est pas si long que ça. Et aujourd'hui, je voudrais témoigner du fait que on est arrivé en France avec les services du Premier ministre, avec une société qui s'appelle Réseau de transport d'électricité, qui gère le système à haute tension, enfin finalement qui pilote la transition bas carbone en France fondamentalement. On est arrivé à un degré d'objectivation et du diagnostic et des éléments clés de la thérapie qui est assez réconfortant, et qui finalement tombe sous le sens, puisque peut-être la seule ligne de vie que nous avons face à l'ensemble des dangers qui nous menacent, et en particulier face au climat, c'est que ces dangers sont largement objectivables. Et c'est peut-être la première grande crise à laquelle sont confrontées les sociétés, qui est ce caractère d'objectivation possible. Et aujourd'hui, il y a un grand consensus, en tout cas de la part des gens qui conseillent les élus en France, sur ce qu'il faut faire et surtout sur ce qu'on ne peut pas faire. Puisque finalement, sortir des énergies fossiles, ça consiste à, en tant que société, tenter de faire aussi bien avec beaucoup moins d'énergie. Ça, c'est quelque chose qui est très bien compris aujourd'hui par les experts qui, en tout cas en France, et on y a joué notre part, conseillent les gens qui pilotent le système énergétique, l'économie de manière générale, et puis en particulier, j'en dirai un mot à la fin, notre système de santé. Maintenant, une fois que l'information est partagée, ça ne veut pas dire qu'on va, malheureusement, qu'on va agir. Nous, on est dans une phase assez frustrante où on a une grande victoire symbolique, une grande victoire intellectuelle, au sens où on a un diagnostic et des éléments de thérapie qui sont largement consensuels auprès des experts, mais les élus n'embrayent pas ou trop peu. Et ça m'évoque ce que disait M. Gaffney sur le fait que M. Gaffney, vous disiez que les dictatures sont très résilientes. Et ça m'a inspiré quelque chose, je vous le partage, je vais essayer de vous partager rapidement. Quand on parle de transition bas carbone, souvent on fait l'analogie avec un effort de guerre. Les investissements réclamés par la transition bas carbone, c'est l'équivalent. Et là encore, les montants d'investissement sont largement convergents. Là encore, ils sont largement objectivables. C'est comparable à un effort de guerre. Et moi, il y a deux auteurs français auxquels j'ai pensé quand M. Gaffney a dit que les dictatures sont très résilientes. Alors, je pensais qu'en est-il des démocraties? Il y a un premier auteur qui s'appelle Marc Bloch, qui est bien connu des historiens, qui a écrit un livre qui s'appelle L'étrange défaite, où il raconte la drôle de guerre, la manière dont l'armée française s'est effondrée en 1940. Et le pendant de cette lecture, pour moi, c'est Jean Monnet, le père de l'Europe. Jean Monnet a œuvré à aiguillonner l'Amérique pour qu'elle déploie la puissance militaire qui a permis finalement de sauver la démocratie. Et la conclusion de Jean Monnet, elle est intéressante, elle est double. Elle dit, si on est, c'est mon point de départ, être résilient, c'est être informé. Le premier facteur, c'est d'être informé collectivement. Et c'est cette information assidûment relayée par des gens comme Jean Monnet auprès de Roosevelt qui a permis de monter de 3, 4, 5 crans l'effort de guerre qui était prévu en 1939, 1940. Et la conclusion de Jean Monnet, c'est que ça a fait gagner 1 an. Ça a fait gagner 1 an à la guerre. Enfin, la victoire, ça a avancé la victoire d'1 an. Le fait de planifier et de développer les moyens adéquats pour faire face. Voilà. Et l'autre réflexion, elle est peut-être plus... c'est peut-être une dose d'optimisme vis-à-vis du propos de M. Gaffney, c'est ça que ça m'a évoqué. Il faisait référence à Albert Speer, donc, qui était le grand ordonnateur de l'effort de guerre à la fin nazie, et qui était très surpris par les efforts qui ont été finalement demandés et acceptés par les populations britanniques, américaines, pour supporter l'effort de guerre. Et c'est quelque chose, ces efforts notamment par les Britanniques, c'est quelque chose que les nazis n'auraient jamais osé demander à la population allemande. Voilà. Donc ça, pour moi, une fois que l'information, une fois qu'on comprend qu'on est tous dans le même bateau et qu'on est tous en danger, alors les démocraties peuvent se réveiller, et on l'espère. Et pour conclure sur la santé, on a ce même degré de partage de large consensus à la fois sur le diagnostic et la thérapie. Finalement, c'est la même chose de ce qu'il faudrait faire pour transformer nos systèmes de santé, pour les rendre à la fois plus résilients et plus bas carbone, bien plus économes en carbone. Et c'est quelque chose dans le domaine de la santé, en tout cas en France, je ne peux pas parler pour les pays en développement en particulier, où le problème est bien plus compliqué, bien plus aigu, mais en tout cas en France, il y a une espèce je dirais, de feu sacré, d'énergie comme ça, une fois que le diagnostic est largement partagé. Alors peut-être que les gens qui sont des professionnels de la santé sont particulièrement sensibles à ces notions de maladie. En fait, nos systèmes sociaux sont malades de leur addiction aux énergies fossiles. Et pour conclure, d'un mot, ce consensus sur la bonne méthode thérapeutique, ce qui est intéressant, ce qui est encourageant, c'est qu'il rejoint, finalement, il est parfaitement convergent, très largement convergent, avec beaucoup de choses que disent les professionnels des systèmes de santé. Il faut mettre le paquet, si j'ose dire, sur la prévention, sur la santé environnementale. Ça, ce sont des facteurs massifs d'économie d'énergie pour nos systèmes de santé. Le bon système, un système de santé résilient efficient face aux enjeux bas carbone. C'est le même système de santé finalement qui est efficient vis-à-vis de l'objectif d'avoir globalement des populations en bonne santé. L'idée étant que le meilleur moyen d'économiser, d'épargner le système de santé, c'est de faire en sorte que les gens soient, ça tient de la, c'est presque trivial, mais c'est réel, que la population soit globalement en meilleure santé. Et on s'est retrouvé d'un mot, on s'est retrouvé en parfaite convergence là-dessus avec l'assurance maladie en France, la Caisse nationale d'assurance maladie, qui a dit, mais c'est très intéressant, vos histoires de transition bas carbone, finalement, ça nous donne un argument supplémentaire pour faire ce qu'on cherche à faire depuis des décennies, avec plus ou moins de succès, c'est-à-dire faire de la prévention et faire de la santé environnementale. Voilà. Là, le pire n'est jamais sûr.
Merci beaucoup.
Sûr une fois qu'on a bien compris le diagnostic et qu'on partage des éléments de thérapie.
Merci beaucoup Mathieu pour ces réflexions, comment on passe du diagnostic à l'action. Pour toutes les personnes qui sont en ligne, restez avec nous, on va prendre des questions aussi en ligne d'ici quelques minutes. And for all of you here as well, just stay with us. We're going to also take questions. I'm sure this is inspiring you with a lot of questions to share with all the speakers. So just 10 more minutes and then we'll turn to the questions. So thank you, Mathieu, for talking about the convergence actually on these win-win opportunities for climate and health. Now I'm going to ask Simon maybe some more provocative thoughts because we are already at 1.43 degrees of temperature increase. This is what the IPCC scientists have predicted. And we're going to hit 1.5 degrees this year, very likely. So that's the target that was set in Paris. So Simon, is incremental change enough? How do we go beyond business as usual? And how do everybody talks about mindset shift, radical shift, but how do we actually make it happen?
I think if I knew that, I'd get the Nobel Prize. But let's see if we can figure it out in the next hour. So some thoughts. So climate change is the crisis, but not the problem. The problem is that we have all the capacity to act, but we don't. And so we have to separate out the nature of the crisis from the nature of the problem and try and unravel how we have found ourselves in that situation. It's interesting perhaps to think about types of crisis where we do act in extraordinary ways. Take the COVID pandemic. Notwithstanding the many things that went wrong, and in the main, the lack of solidarity between the global north and the global south, we responded in the most extraordinary way. Just one simple statistic, we raised and spent across 15 countries, $15 trillion in 36 months. Now set that against the commitment made to provide $100 billion to the global south each year to address climate change, which since the commitment was made in 2015, we have managed as a wealthy north to succeed in one time, 7 years after the commitment was made. And the $15 trillion, unless my maths is wrong, is 150 years worth of that $100 billion that we raised and spent in 36 months. So what do we learn from that? Well, we learned there's a lot of money around, that's for sure. Although the later payoff, of course, has also been extreme, and we can come back to that. But maybe we learn something else, which is that the climate crisis is the wrong kind of crisis. Yeah, that there are certain types of crises that humans collectively respond to in extraordinary ways. and notwithstanding everything that we know about the climate crisis, it does not fit in to that category of crisis. So perhaps rather than immediately thinking, how can we invent some more solutions, we need to think, how do we create the right kind of crisis to unlock multiple innovations and massive expenditure of resources that we see from COVID to the Middle East and Ukraine, in awful, often contexts. And is it possible that we as a climate community are preventing the right kind of crisis from emerging? So the Paris Agreement commits us quite rightly to the ambitious target of trying to maintain temperature rises to around 1.5 degrees, or hopefully less than 2 degrees. And the climate community's narrative broadly is, if we don't do that, we're all going to die. And actually, it's not true. First of all, it's not true we're going to stay within that temperature boundary. We're heading casually for 2.5 degrees or above. And secondly, actually, the answer is we're not all going to die, but the climate community's focus on catastrophe if we don't maintain our temperatures below 2 degrees is actually preventing us from reshaping a narrative, perhaps into a crisis that can elicit exactly the kind of extreme and extraordinary responses that humans are capable of. That actually a climate narrative that says we are absolutely heading north of 2 degrees and we need to plan for it now at scale may turn out to be the right kind of crisis. But it may not. I know I'm being pestered from the front. I may slip slightly over, but I am talking really slowly. So give me a little bit of slack. So if we consider the possibility that as the narrative undoubtedly shifts globally, as it becomes absolutely clear that the 1.5 or indeed 2 degree narrative is simply flawed, the most likely outcome is that the right, populist authoritarians, climate deniers, those with incumbent and self-interests will capture that narrative and reduce ambition. And so our challenge is not, as a progressive community, to hold back the narrative to we have to keep it below 1.5 degrees, but to understand that the narrative is shifting and it will be contested as to who owns it going forward. Can we as a progressive community own that narrative shift and catalyze the kinds of actions that we know are needed? And I'll just give, in my -3 seconds, 2 very small examples, and we can come back in discussion. There are going to be more than 1 billion refugees. They will be permanently on the move, devoid of any Westphalian citizenship. Just eat it up. The question is, are we trying to solve that in a, at best, late 20th century humanitarian model? Or are we capable of going, not that's pessimistic, but that's what's going to happen? And we need extraordinary innovation to reconceive what it means to have 1 billion people permanently on the move, devoid of Westphalian citizenship. Are we really going to keep investing in regenerative agriculture in the tropics when at 1.8, 9, or 2 degrees, there's very little soil in many countries at that axis? Are we investing ideologically rather than really facing that we need a completely different kind of food production system in those regions that don't depend on soil, that actually don't depend on open weather conditions. We know how to do that with renewables. Do we know how to do it with vertical farming and lab-grown protein? Not for Californian hamburgers, but for people to survive in sub-Saharan Africa. That surely we should be embracing not just the scientific reality that we're hearing of, but the importance of shaping a narrative that precipitates the kind of radical actions that we see in other contexts, but that we have as a community completely failed to precipitate in this important context. And I'll leave it there. Thank you very much.
Thank you so much, Simon, for shifting the narrative and helping us to really face this reality that we are going beyond 1.5 and that we're going to have 1 billion refugees looking for livelihoods, but also that change is possible. So how do we have a positive narrative? How do we have this extraordinary innovation? So we hope that what we're doing today will contribute to what is needed. And Jamila, over to you now, because we spoke together last week and you were very clear that you wanted to talk about bold action on the ground in the Global South and this need for political will also to address what Simon has been exposing to us today.
Thank you. It's very hard to follow that, Simon, but I'll go back to the boring stuff. That is the mitigation bits. I think I just want to know in this room, how many people are in the health sector?
What?
Not that many, yeah? Okay, good. So yes, we will be heading towards 2.5, but even as it is now, the implications on the health sector is tremendous, and particularly in countries which are low and middle income countries. So the impact of climate change, and climate change, as you rightly pointed out, is not the problem, the inaction that's the problem. But don't forget that what led to climate change is actually what Owen was talking about, the planetary boundaries being breached, you know, the land use, and so on and so forth. But in terms of health implications, there are many. There are direct implications and there are indirect implications. The direct implications are actually deaths and injuries. I come from Malaysia, and normally we boast that we are surrounded by Indonesia and Philippines, so we're kind of protected. You know, Indonesia is always, they used to say Indonesia is the supermarket of disasters and Philippines is the 7-Eleven, but Indonesia now says they're the best laboratory for disasters, much more positive. So I think that it's not true, because now we're experiencing terrible floods, cyclones, and so forth, and even deaths. So the impact on premature mortality of climate change is extremely high. If you go to the OECD website, you'll find country by country and the premature mortality, but also the cost of that mortality. You know, for those who are in the non-health sector, the indirect implications obviously will be things like infectious diseases. You're seeing now malaria, dengue in North America. There's more Lyme disease and more infections coming out. You know, tuberculosis is back. You know, all these infectious diseases, but also the climate change and heat, for example, causes a rise in non-communicable diseases. And that includes diabetes, hypertension, cardiovascular diseases, and so on and so forth. Added to that, of course, is heat itself is causing a lot of medical conditions. And unfortunately, many health professionals are not trained on climate and health. I graduated medical school in 1986, and I wasn't taught about climate and health. Today, only 15% of medical schools teach anything on climate and health. So how do you expect doctors and nurses to ask a proper history when people come in with a cardiac event? How much heat exposure has happened and so on and so forth. You know, you mentioned about the pilgrimage in Mecca. And that was not just because of heat, but that was because of social justice. The fact that these people were not registered pilgrims and were not given access to cooling rooms and so on and so forth. So it's not just the heat that killed them, right? So I think we have to be aware of all this. And of course, rising medical issues are mental health issues. If you talk to young people around the world, you know, many of them will tell you that they don't want to have children. They're facing terrible stress and grief looking at the climate, but they're inheriting the planet that we have actually destroyed. It's our generation. So based on that, you know, I just want to say that the health implications are very severe, even at 1.5, even now, today, we're at 1.43. And it will be more pronounced in the low middle income countries because health facilities will be impacted. And you actually do a mapping country by country, you will find that many health facilities are actually in areas where it will be inundated by rising seawater and so forth. So I just want to maybe correct a perception issue that we always talk about planetary health and human health. Actually, planetary health is human health. So we shouldn't use it separately. And the planetary boundaries are an incredible discovery that guides us into looking at boundaries. 1.5 is not a limit, it's a boundary that we need to think about. So let me share with you what is possible. I agree with Simon, we have to start reimagining 2 degrees, 2.5, and finding solution for that. But at the same time, based on what our countries, our governments have agreed upon, we need to also be pragmatic. So I've been quite involved in developing Malaysia's National Planetary Health Action Plan. It will be the first country in the world to develop one, and it should be ready by the end of the year. Can we go back to that, that slide? So when you talk to governments, they'll tell you, well, we have sustainable development goals. Why do we need to look at planetary health? You know, why do we need to look at the connection between the health of the planet and health of human civilization? So what we normally do is use this diagram, which we call the wedding cake. And the bottom part of this wedding cake, so to speak, is actually the planetary boundaries. And you can actually map those planetary boundaries against sustainable development goals. The problem with the SDGs is it's very siloed. How can you talk about health without looking at gender equality, without looking at water, food, and so on and so forth? So in trying to develop this planetary health action plan, what will happen, what will need to happen is a breaking of the silos, even interministerial and so forth, and putting health at the center of everything. And health is so central to everyone, every individual, every family member, every parent. And, you know, we had the pandemic to remind us how valuable health was. And on that note, to the health workers in this room, we are the most trusted individuals. We should be talking about climate change to our patients, to our, you know, every leader has a physician and a nurse that attends to him. We need to be the people who are trusted to be able to convey those messages, because change doesn't happen because governments want change. Change happens when civil society, when, you know, activists, when the private sector raises issues. Think about the greenhouse, what do you call that? The greenhouse protocols. That was led by NGOs, right? So my message really is that I think it's possible for us to move forward. Apart from the fact we acknowledge and recognize the terrible stress we're under with these changes, we also need to talk about what is positive, what is possible. And I think, you know, for those who are interested, you can look at the Tipping Points report led by Exeter Systemic, you know, Tim Lenton and company, that will give us some inspiration on that. I think the power of storytelling is going to be incredibly important as a tipping point. Thank you.
Thank you, Jamila. So it's going to be time for questions now. I think we're going to just take a 30-second break. So maybe you can just stand up just to get your energy level up and stretch. You have a laptop, please put it down. And just think about what you've heard, any reflections on any questions you will want to ask as well. So get ready. Thank you. Thank you. So there should be a microphone going around. Yes, over there. So please keep your questions really to the point, and ideally also saying who you are and if this is addressed to one of the panelists or several of them. So Pete, put your hands up when you're ready. I see one here already.
We will start with a question on the chat.
Okay.
Yeah. First question from Wako Kamaina, independent consultant based in Kenya. As lifelong humanitarian, one lesson I've learned time and time again is that true and tangible resilience lies among the affected population on a micro level. Shouldn't the focus therefore be to learn to better assess?
I think you need to speak slower.
Okay,
otherwise.
sorry.
Thank you.
Shouldn't the focus therefore be to learn and better assess the vulnerabilities and capabilities of the populations and aim to support its grassroots capabilities rather than continuing to pursue global solutions that seem untenable due to the lack of political will?
I'm not sure we understood, but this is about how do we assess the vulnerabilities of people on the ground? Is that correct?
Yeah.
The local level versus the global level. So how can you be more context specific in terms of what people need at the local level? That's probably for you, Jamila.
Should we take a few questions?
Maybe, yeah, let's take, do you have more questions to share with us? Let's take 3 questions.
Not yet in the chat.
Not yet, not
Please.
yet in the chat. So maybe in the room, anybody else would like to ask? Or also for the panelists, you may have reflections to share or to questions to ask each other. Oh, I see one over there, actually.
Thank you. I'm Gaurav Garg, and I'm with IQVIA, which is a healthcare company. I'm based here in Geneva. So I come from like a health background, used to work at Gavi and UNICEF before. My question is around climate financing. So there's a lot of buzz, money being committed, some of it comes through. But that also means that at the government level, there are a number of these ministries or silos that are also trying to get a piece of the pie. Now, at the country level, what is the thinking around rationalizing what's coming in terms of where the greatest needs are? So if it's the health sector, if it's the infrastructure, if it's electrification. So any thinking, any suggestions, but also maybe any best practices from what you're seeing across the world to find a way to address the competition for resources that we see not just at the global level, but fairly certain that it also happens at the country level, at ministerial level, at levels of organizations and so on. Thank you.
Thank you so much. Maybe one more question? Over here.
Thanks. I'm Sonia Roshnik, and I work for the Geneva Sustainability Centre. And I really love this question about how do we change the narrative, and how do we unleash the huge human potential for innovation and change and transformation, which is a real message for hope for me. I'm a health professional. I would like to ask all the panelists to reflect on what that means in their sphere of influence. Thank you.
Thank you. Any more questions from the online participants? One more?
Yeah, 2 questions more. Prevention has been described as a core activity to decrease carbon impact of healthcare sectors. How to promote prevention activity as humanitarian actors? The first question from David. And another question from James Moon from ITVA. Sorry.
Sorry, the first one is about prevention?
Yeah.
Prevention for climate, for health, for both?
I will read it again, slowly. Prevention has been described as a core activity to decrease carbon impact of healthcare sector. How to promote prevention activities as humanitarian actors? And the second question is, if climate inactions leads to the breakdown of state structures and the collapse of traditional governance systems, is it even realistic to think that governments and or humanitarian agencies are prepared for the radical shifts necessary to avoid an unmanageable crisis of climate refugees?
So this is more a comment, I guess, the other one, the last one. Yes, I think it would be wonderful if the technical team could actually show the questions. I was just trying to do that so that we could have them in front of us. That would really help. Thank you. But let's take the questions we have now. I think there's one set of questions on how do you really assess vulnerabilities of people, being very specific to the context, to the local context. One on climate finance and the competition for resources. How do we break the silos? How do we overcome this competition mindset? And the third one on changing the narrative to how do we unlock this potential for innovation? We know that humanity can be at its best in the worst crisis. So maybe we start with Mathieu, actually, who's online, and also if you have some reflections on everything you've heard today. I know, Mathieu, if you're still with us.
Oui, oui. Vous m'entendez toujours? Est-ce que vous m'entendez toujours? Oui, OK.
Oh, we can't hear you. We'll go back to you. Anyone here on the panel who wants to answer these first few questions? Jamila?
I think that's a really important question because you have to look at it contextually, because the global picture is important because it drives kind of global sort of initiatives, more intergovernmental processes and so forth. But finding solutions at local level is very important, and making sure that people understand what happens locally also impacts globally. So that link has to happen. I would point you to, I really like this website. It's called the Leeds University Good Life Index. And it has country by country, you know this, right, Owen? It's Andrew Fanning and company. It breaks down country by country, the whole planetary boundaries and how you're doing at country level in terms of emissions and so on and so forth. So that can actually give you a picture of what's happening. And I want to link this to the second question. Simon can do the big picture stuff, but I'll tell you what we do at local level. How do you then convince governments to put money into climate activities? So as part of the National Planetary Health Action Plan, but also just to share with you that in Malaysia, we do 5-year economic development plans. So at a recent meeting where planetary health is embedded in our national development plans, what I was able to do was to show the Ministry of Economy that the cost of fossil fuel related climate issues, but also health issues, far exceeds the subsidies provided by fossil fuel companies, which means that basically you're paying for their pollution. And being able to link to health and showing the impact, and the data we have is only mortality, not even morbidity, which is even going to be higher. So I think making that case, and again, breaking the silos that health, 80% of determinants of health are outside the health sector. So, you know, for the health sector, for us to prevent illness and to promote wellness, we have to tackle those 80% outside. But the elephant in the room is the fossil fuel industry. And this is where we all need to stand up and be smart about it, right? Everything that we do that is positive will be spinned by the fossil fuel industry. I'm part of the Fossil Fuel Non-Proliferation Treaty group, and I think we almost need to be combative now, and also, you know, find ways for legal recourse. So one of the things we are trying to set up is a health tribunal to look at, you know, the costs of fossil fuel industry on health and bringing it to legal courts. I was recently involved in providing an expert commentary for the Pacific Island states, and they really liked it. It was on climate and health, and they have now taken it into their docket for ICJ. So these are the International Criminal Court of Justice. So I think these are the things we need to start thinking about, you know, the legal frameworks, the tribunals, and so on and so forth, because until we address the elephant in the room, you know, it's going to be just talk.
Thank you so much, Owen.
Yeah, on the vulnerabilities first. So, I mean, so Bangladesh, currently 7% of Bangladesh government income is spent on adaptation. I think that's an incredibly powerful statistic. That is going to keep on rising as that is not going to get lower. So this 100 billion we talk about for the developing, so-called developing world is a drop in the ocean of what's needed. And in places in sub-Saharan Africa, it's higher than 7% government income being spent on adapting to the current crisis of sea level rises and unpredictable crops and all of these issues that we now have to deal with. This is a systemic issue, that we need to find solutions for. On the issue on climate financing generally and where we're going, we're seeing pockets of the world, China, parts of Europe, where there's huge amounts of money going into it, and you're seeing very, very rapid transformation. In other places, it's just woefully inadequate. There are so many systemic issues. There's it can take 10 years from having an idea about setting up wind and solar to actually having them on the ground operating. And this has to, and that's in the US and parts of Europe, and much longer in Africa and parts of Asia and South America. So we need to get much, much better at that kind of planning. We can't expect public-private investment at the scale needed until we sort of overcome some of these sorts of issues. We often use this fact that wind and solar are the cheapest form of energy now. That doesn't appear to matter in terms of the scaling. They're just still not profitable enough for the big investors to go in there. So we still need huge government support everywhere to ensure that that the private investment can get in. Which why I think things like the UK and in some way, having a government agency on energy seems to be like the right way to go to pull in the kind of investment needed and scale things properly.
Thank you. And Owen, on what you've heard, but also on that question on shifting the narrative and the potential for innovation as well.
Thanks. So Groucho Marx said, if you can kid all the people all the time, you've got it made. And that's what the climate community is doing. Think of the narrative. We're all in the same boat. Ever heard that one before? We're not all in the same boat. Yeah, that actually the ultra-rich, which includes most of the people in the room, are well advanced in their plan not to be in the same boat. Or think of businesses don't survive in a broken society. What rubbish. The most profitable moments in history in the last few years have been actually the carbon community and the food traders over the last 36 months. Yeah, and the examples are endless. So firstly, we got to stop bullshitting ourselves. Really, 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 just dump the crap, right? And start being honest, not just to ourselves, but to others. Yeah, and I do think the climate community has not, of course, nobody in the room, but I do feel the climate community has a profoundly patronizing view that we can't tell the people because they're all going to respond in the wrong way. And I could quote a number of terribly important people like Johan and others who have said exactly that. So let's trust, as part of our understanding as to how to build resilience, that people need to understand, and that's a way not to unlock apathy and xenophobia and inward-lookingness, but a way to unlock ambition and collective action. But that doesn't happen automatically. Yeah, as we've already said, and we can see the gun turrets going up around Europe as well as elsewhere as an easy proof of that fact. So that's kind of number one. Let's fess up and talk more openly that we are heading into that world. We're not all going to die immediately, and that we need radical innovation. And what might that look like? Are you willing to ask financial regulators to prevent financial institutions investing in carbon assets when it will seriously damage your pension funds? Are you okay with that? Because if you're not okay, you better be open about that now, because the win-win narrative, invest in the future and we're all going to be fine, is just totally ridiculous. I mean, it's just absolutely complete trivia. Yeah, that we have to give up a lot in order to live in any sane way into the future. And at the moment, we as the climate community are not willing to have that conversations, even in our own heads, let alone with others. And I don't mean to turn this into a therapy session. I'll leave that to somebody else. But I do think it's worthwhile making the point. Can I just make an observation about finance? Since I know, actually, I was invited onto the session to talk about finance, so I need to at least pretend I know something about the subject. So the global financial system, may it rest in peace, is part of the problem. And if we don't fix it, it's part of the solution. In fact, core, it is the lifeblood of the global economy. The logic of financial markets shapes the logic of the global economy. If there's one relationship that has to just be absolutely core to our understanding, it's that. So, as it becomes clear that we're going to bust the 1.5 target and go up to 2 and beyond, guess what happens? The value of fossil fuel assets go up, and the value of clean energy assets go down. Why? Yeah, I'm sorry, this is not an exam question. It's because fossil fuel assets go up when the market realizes that policy and regulatory constraints will not strand carbon assets. And so when it becomes clear that we've all screwed up, actually fossil fuel assets become much more valuable. Hey, is there something wrong with that picture? And that's a regulatory issue. So markets will price the future worse and worse, the worse we do. Yeah, which is why we have an extraordinary surge in investment in fossil fuel assets going on around the world at the moment, and seriously constrained profit margins in the clean tech industries around the world that are reducing investment in innovation and large-scale deployment. So, you know, if anyone hasn't realized that that's completely psychotic, you know, they're not really concentrating, that they're looking at their phones. It's obviously insane. And you're right, we've got to figure out how to deploy money on the ground. But actually, the financial system is sucking money out of developing countries. You know, and so for every dollar that, you know, the global fund or somebody puts in, sovereign debt markets are taking out 5. You know, go figure. Why are they taking out 5? Because once they start to factor in climate risk into sovereign risk, Goldman Sachs doesn't pay the price, and nor does Switzerland. Bangladesh does. And so suddenly they're paying a far higher cost of capital because we, as a community, decided to integrate climate risk into financial markets, not realizing what the unintended consequences were going to be and trying to figure out what to do. So if you leave with anything, sorry, I will stop. It's that, yes, of course, the real economy counts. And yes, of course, public finance counts, and the way it's allocated at a local level is critically important. But the bear in the room is the way in which financial markets work. Yeah, and unless we're focused on how not to just get more money from A to B, but to shift the logic of the way financial markets work, we're just fighting against a tsunami and don't have any chance at all. Thank you.
Thank you so much, Simon, and I'm so glad you spoke about finance. Maybe you know here that there's going to be a finance initiative in Switzerland, because the finance sector here is responsible for 14 times more emissions than the population. So I'm sure you will hear about it. We're going to support it as she builds bridges, also the Swiss Climate Alliance. And there will be a lot of noise around it in the lead up to International Women's Day. We count on you, at least for people who are here, to sign this initiative. It's really, really important. We have a small country with big impact. So let's also act here. So I think we have about 5 minutes left before the closing. And I'm just going to ask, before I turn to Mathieu, is there any burning question in the room? Anything you want to ask? Obviously, there will be time to continue the conversation during the break. I see a lot of open eyes and open hearts and open minds, so that's a very good sign. If there's no burning question, Mathieu, I'm going to give you the challenging task of answering some of the questions you've heard and at the same time sharing a few closing words. Over to you, Mathieu. I hope you
Ouais,
can hear
bon,
you.
j'espère que vous m'entendez mieux là.
Yes.
Merci. Ouais, ok. Non, la question sur le lien entre prévention en santé et réduction du bilan carbone de la santé, ce que je peux dire, c'est les chiffres auxquels on est parvenu au Shift Project en faisant le bilan carbone du système de santé en France. Les tout premiers postes d'émission, ce sont l'achat de médicaments. C'est que les médicaments en eux-mêmes, la chimie, la chimie pharmaceutique emploie beaucoup de dérivés de nafta, de pétrole et de gaz. Donc le tout premier poste d'émission du système de santé français, de l'ordre de 30%, ce sont les achats de médicaments. Viennent ensuite les achats de dispositifs médicaux qui sont très souvent faits en plastique. Et c'est bien, parce que le plastique a permis de faire des progrès énormes en prophylaxie. Et ensuite viennent l'alimentation, en particulier l'alimentation carnée, et les transports. Les transports des usagers, des visiteurs dans les hôpitaux. Donc vous voyez, pour ces 4 postes, on se rend compte que donc l'achat de médicaments, l'achat de dispositifs médicaux, l'alimentation, les transports, on se rend compte quelque chose d'assez trivial, c'est que moins vous utilisez les équipements médicaux, plus vous baissez votre bilan carbone. Ça paraît bête à dire, mais en fait, c'est la réalité. C'est-à-dire que le meilleur moyen pour réduire le bilan carbone de nos systèmes de santé, c'est d'avoir globalement des populations en meilleure santé. Et là-dedans, il y a beaucoup de win-win solutions. Par exemple, le fait d'avoir dans des villes où l'air est respirable, une capacité à se déplacer autrement qu'en voiture, notamment alors dans les pays riches, c'est particulièrement saisissant en vélo, eh bien, c'est l'un des facteurs. Je prends ça, c'est emblématique, hein, ça ne résout évidemment, ça résout pas tout, mais globalement, avoir une population qui fait davantage d'exercice physique, c'est une population en meilleure santé, et donc c'est un bilan carbone réduit. Et peut-être c'est ça mon mot de la fin, c'est que aussi bien le diagnostic est largement objectivable, les réponses qui permettent de se projeter concrètement dans une société post-énergie fossile offrent plein d'issues heureuses. Je pense qu'avoir une population qui a un rapport plus salubre avec son environnement, c'est une population en meilleure santé et dont le bilan carbone est réduit.
Thank you so much, Mathieu. It sounds so obvious when you say phasing out fossil fuels is good for health. And I know a lot of city mayors know that, but heads of states and ministers of economy and trade, maybe not as much. Owen, over to you. Any closing words? So I'm going to ask you to be to the point, maybe 1 or 2 sentences of conclusion. What is it that you take away from this panel? And any message for the audience, any call for action?
Yeah, so I mean, on the narrative side of things, take this on. We did a survey with Ipsos recently of G20 countries, and we found that most people are very optimistic about their own future. and they're less optimistic about the future of their country, and they're not so optimistic about the future of the world. But it's very positive that people are optimistic about their own future. I mean, not least because Nobel laureate Dan Kahneman said, you know, the future is created by optimists. And I think we need to be optimistic about what we can achieve. And I think, you know, 20 years ago, we didn't know how to run a global economy on clean energy, that it was possible. We didn't know how to solve the food crisis. We didn't know how to solve the poverty crisis, poverty in the world on the levels that we do now, and population issues. We didn't know how to solve those. On the major issues in the world, we do know now how to know now. We have the knowledge on how to address them and can do it very quickly. So that should give us some hope and some reasons to be optimistic about it. I think for me, the key thing is that we need to strengthen our political systems. If we value democracy, we need to strengthen democracies to allow, because the other thing we found in the surveys is people do want change. They just don't trust governments to deliver. That's why they're voting for right-wing politicians who promise to transform the government system. You know, we need politicians who will have a transformative agenda and that can show that they can be trusted to deliver it for the majority, not just the elite.
Wonderful, thank you. Who wants to go next? Simon? I know you want to go last. So.
Sure. Yeah, what does one say that's useful? So maybe just to keep in one's mind, climate change is the crisis, but not the problem. The problem is we got the wrong kind of crisis. Yeah, because we know humans can be extraordinary at scale really fast in the right kind of crisis. And so although we're all trained to try and figure out what the solution is, actually, we've got to spend more time on figuring out what the right crisis is. Yeah, and I know that sounds paradoxical, but hey, what the hell? Things are strange in the world. So that's number one. How do we do that? We have to ditch the win-win, because the win-win was meant to encourage actors to make first movers and actually has deteriorated into doing nothing that doesn't deliver a win-win. We have to understand that we have to give things up and we have to move away from a narrative that sounds cute, we're all in the same boat together, and no one believes. Trump exists on the back of those misstatements by us, and we need to discard them because they rightly lead to gross disbelief. And then final comments. First of all, the mitigation, adaptation, difference is a moot point. Yeah, that actually, yeah, most people will become increasingly concerned with adaptation, and understandably so. And we need to understand that action on mitigation will emerge out of more radical action on adaptation. Yeah, we need to understand that there's a different pathway emerging and to take advantage of that. And the final observation, which pays for my why I'm here anyway, is it's finance stupid, as they say, not economics. Yeah, that it's the financial sector that shapes the global economy. And our obsession with how do we raise more money, whilst understandable, misses the point that finance is a system in the same way that health is a system. And it has a logic that at the moment is destroying us. And that logic can be changed. Thank you.
Thank you, Simon. Jamila?
I've always, I think, being a realistic optimist. Otherwise, I think you cannot be a humanitarian. But I always go back to the 3 Ps that are required. First of all, political will and politics, which is extremely difficult. That will then shift into the second P, which is good policies and changes that are needed, particularly on financial systems. But that will happen when there's power, and power is actually from people. And therefore, you know, we have to continue encouraging activism, civil society. I think that's important. And that power has to be continually, as an obstetrician and gynecologist, I always say, push, push, and push.
Thank you so much, Jamila. And let's push together for the finance sector to phase out fossil fuels. I think that's quite a good call for action. Okay, I think we're going to close, and we want you to feel energized and to feel ready for the next few panels. I think in about 20 minutes, we're going to talk about generating knowledge and then partnering for change. I also would like to say, at least for me, resilience also starts with our community, with our friends, with our colleagues. And so please take this time to turn to your neighbor on your right and say hello, even if you don't know that person, and even hug each other. And let's continue the conversation during the coffee break. Thank you.
Merci beaucoup, au revoir.